So this part of the lecture will summarize counselling as a form of intervention for treating depression. And just to recap, the tutorial is for educational purposes only. It's not designed as a diagnostic or to treat anyone or to make any recommendations, learn to deploy techniques as part of a treatment plan. It's for educational purposes only. So we'll summarize counselling. So as we discussed, counselling can take several different forms, but essentially it's a person-centered approach, and it takes an exploratory look at someone's circumstances, trying to find a more resourceful way of living, for example. So this is not an exhaustive list that we've sort of covered previously, going to sort of touch base on now. But generally speaking, the ones we've covered have got a strong evidence base for treatment of depression. If something is missing in what we've sort of discussed in the lecture previously, it's possible that the evidence base for depression is not particularly good, or the research hasn't yet have been carried out. So focusing on counselling, as a definition, counselling, definition being a systemic process which gives individuals an opportunity to explore, discover and clarify ways of living more resourceful with a greater sense of well-being. Counselling can take many forms, but in essence, we're exploring and discovering how to live more resourceful. It's most often delivered in primary care settings rather than in specialist centres. In essence, it is a client-centred, but they draw on all different therapeutic approaches. So there may be psychedelic influences there, there may be systemic influences there may even be cognitive, behavioural skills thrown in. So it can be a mixed bag, so to speak. And when you meet somebody that's having counselling, it can be difficult to ascertain. It can be sort of difficult to ascertain exactly what. Now, from the perspective of PCT, obviously we've talked before about, you know, one staying on their remit. That's sort of, you know, goes without saying. So, you know, we've stressed how important it is to stay within the remit. And generally speaking, counselling is going to be geared up towards that sub-threshold level of depression, but equally the clinical expert will decide on that, so to speak. But, you know, I can't emphasize how important it is for someone to sort of stick within your own remit. But sort of generally speaking, PCT and depression, so some of the useful things to consider: the person feels listened to, the freedom to speak. I suppose the counsellor provides the well conditions, helps the client look at problems in more depth, to really focus on what's important. The counsellor showing the client that you only can make changes, the client can only make changes, responsibility for those. Being able to go to somebody else about who you are and how you are, and the realization of being able to move forward, the confirmation of knowing what to do, and a counsellor exploring a situation may help make sense of it. So that's sort of from a counselling perspective. We sort of covered other therapeutic interventions in previous lectures.